Well, I think that's a real barrier to patients electing to have transplant or CAR T therapy, that there's a requirement for caregiving. That has a big financial impact. You know, obviously, if people are working or engaged in child or elder care. So I've always thought that the NMDP really should help fund some sort of caregiving plan to help that. But I don't know what your thoughts are.
Yeah, I think, you know, when you have a 55-year-old getting an autologous transplant who's ECOG 0 and they're just getting melphalan, do they really need a caregiver from days 16 to 28? You know, they bounce back like that, almost like they're pediatric patients. So
yeah, no, I think that's a good point.
So I think, yeah, and I think this is something we are kind of looking into a little bit, especially with the looser rules with CAR T, is really careful patient selection. You have to know your patient really well and understand sort of, and warn them that, hey, things may not go our way, but if you're following these recovery pattern, you know, from day to day, and we can predict you'll probably be okay, and coming up with a way to make it feasible and accessible to them, I think, is a priority. But yes, I think things like help with transportation and other costs that we just have trouble getting them funds to do would be helpful as well.
Great. Okay, we have a few questions from the audience.
Yep. Hi, I'm Suhail. I'm an internal medicine resident in the University of Michigan Spare. So thank you so much for highlighting all the promises and challenges of the CAR T and bispecific. But as a resident, I do have very limited direct exposure with the CAR T cells or bispecific. But what I can say is I can see on my practice that the side effect profiles of the CAR T cells, the bispecific, like a CRS, ICANS, has been increasing. Do you think like recognizing early and giving the trainings to the primary care doctors or hospitalists is equally important so that we can decrease those disparities in both academic and community hospitals? Thanks.
Melinda, do you want to take up that one?
Yeah, I mean, I think our model has everything highly specialized. So, you know, we're an academic center. We have an immunotherapy inpatient service, but that doesn't translate everywhere. And I think that the future really is going to be that CAR T moves to the community. And so, yes, it's not rocket science to manage these toxicities, especially when they're in the mild to moderate range, as long as you have the right tools available and someone that a friend you can phone. So yes, training folks in the community, training more generalists on how to manage these toxicities, and then having centers that are academic centers or primary CAR T centers be the resources. And then I think the other piece of the future is as we do get more CAR T in the community, I think that means that the complicated patients, the ones who are at higher risk for toxicities, are still going to come to places like Fred Hutch and academic centers that are highly resourced.
Yeah, just wanted to add, because we've been trying to work on something similar to the hub and spoke model, and being able to develop algorithmic approaches which can identify which are the low-risk patients that can be treated in the community versus the high-risk ones, whether it's based on disease or other things that need referral to a more tertiary care center. I think that would also be helpful in terms of expanding access.
Okay, great. Next question.
Just kind of riff off that. I had 2 patients with allogeneic transplants or need for it. And in both cases, we were not able to identify a caregiver to stay with them. And we were really under tremendous pressure with time and with advancing disease. CAR T, obviously, it's a little bit easier and there's a little bit more bend. But Dr. Ballen, I love the idea of, I was surprised when I referred this one to the Hutch that I had assumed that they would find someone in the community who was paid to do that work, and obviously they didn't. And what a shame that was, and what a letdown.
This is, I think, like I was ready to echo your not having caregivers, especially for our allo patients where you really do need a caregiver. But it currently just does not exist, and there is no insurance coverage for paid caregivers. It's very expensive. There's a lot of like housing-related hurdles. I mean, it's a nightmare, and it's devastating to have to turn a patient away because they don't have a caregiver.
Yeah, one thing we're looking at in our institution, and we're fortunate to have some grateful patients who want to fund this, is sort of a group caregiving, like a camp counselor model, where, you know, we would rent an Airbnb and maybe have one caregiver, a paid caregiver for 3 or 4 patients. So that is something that we've are hoping to implement in the next year or two, but I think it is a big barrier.
Something that we have learned in our Access Initiative, one of the projects has been on a PCORI caregiving grant that is, again, a multi-stakeholder sort of project, and they are trying to gather information from different centers. So I didn't know that Mass General is actually able to do transplants without caregiver requirement being so stringent, and they use community resources like church support and things like that to be able to supplement if it's lacking. But honestly, I think as a clinician, it worries me. We've had patients who did not have a good caregiver plan and they ended up having a bad outcome. And so trying to come up with something that's kind of a middle path, I think, would be the best here. But I know it remains a big challenge.
Thank you all very much. This was the last session of the day. You all did a tremendous job. I'd like to thank all of you for staying through the end of the program today. We have a gala tonight. I'm hoping all of you can participate in that. And then tomorrow there's going to be something very different where we've never done before, and that's a Shark Tank presentation. And 3 or 4 people have already been chosen for that. Tomorrow we're going to see some of their abstracts, but then there's going to be a field of experts to talk to them, ask them questions. Originally, we had planned for the audience to choose the winner of these grants. They're $25,000, so they're substantial for early career development. But in this context, I think the committee has already chosen the winners, but we'll have that back and forth. Thank you very much.